In general, I'd say that Dr. Litter and I find Middle Eastern noses to be some of the more challenging rhinoplasty that we have to do. It's really important to understand the aesthetics there. Most Middle Eastern patients tend to have a little bit more of a longer face, and it's compounded by the fact that the nose oftentimes itself is also longer. There tends to be a little bit of a bump. Sometimes the tip itself is a little bit droopy. The skin itself tends to be thick, and that's something that most people don't talk about with Middle Eastern noses, is the skin itself is relatively thick. It's not like other ethnic groups where there's that fibrofatty layer. The skin itself is a little thicker, meaning it's harder to make it contract, and if you're trying to get real definition, that's really important. So,
yeah, many of the Middle Eastern patients who come to see us, I think, really are attracted to our natural results and our understanding of that aesthetic. A lot of them are really afraid of some of those bad, done, scoopy or pinched noses that they've seen elsewhere. And I think it's a testament to the fact that the approach that we use together really is about preserving their structure, and in fact making it more structured rather than that reductive rhinoplasty technique that takes away too much cartilage.
Absolutely. It's really important with Middle Eastern noses to make sure that that underlying structure is there so that the skin can then contract to it and give you the definition that you want. The sort of standard idea of removing cartilage and hoping the skin contracts down, that's a lot of the reason that a lot of Middle Eastern patients are terrified. They've seen patients who notch, who collapse, fall in, get overly scooped out, things that are really unnatural, and none of those things ever need to happen. So if you go to people who really have an expertise in the process and have these sorts of patients regularly like we do, I don't think it's ever a problem.
Yeah, so our message to Middle Eastern patients is, if you're nervous about a potential result, come on in and see us. We'll give you a very good idea with imaging of what you can honestly expect from surgery and what we recommend, and we can really take away that fear and know that you're going to get to a really good place.
Yeah, there should be no concern at all. You should have a fantastic